Okay, so my digital essay is on substance abuse amongst adolescents. So, a brief elaboration. The goal of this digital essay is to explore why adolescents are abusing substances, how frequently young people are using substances, what are the risk factors associated with teenagers using and abusing substances, what demographic are at risk for substance use, and also that the CDC defines high risk of substance use as any use by adolescents of substance with high risk of adverse outcomes. The population affected, the population surveyed will be non-institutionalized population in the United States from the ages of 12 to 18 years old. This digital essay will focus on youth from various racial demographics. And according to the CDC, the majority of adults who meet the criteria for having substance use disorder started using substances during their teen and young adult years. And also that 15% of the high school students reported having ever used, solicited, have ever used, selected, illicit, or injection drugs, so cocaine, inhalants, heroin, methamphetamines, hallucinogens, or ecstasy. 14% of students reported misusing prescription opioids. And this, again, is from the CDC, Center of Disease Control and Prevention. The vulnerable population, according to the CDC, risk factors for youth include family history, favorable parental attitudes towards the behavior, poor parental monitoring, parental substance use, family rejection of sexual orientation or gender identity, association with delinquent or substance using peers, lack of school connectedness, which in turn causes low academic achievement, childhood sexual abuse, and mental health issues. Protective factors to prevent high-risk substance use include parent or family engagement, family support, parental disapproval of substance use, parental monitoring, and school connectedness. So some brief history. Mendel and Feldman published their research concerning the trends of adolescent substance use, and they made sure to explain that towards the end of the 1940s, researchers and lawmakers identified the increasing rates of substance abuse amongst youth, which was worth monitoring and tracking. By the 1960s, illegal substance abuse amongst youth was no longer just an issue that some communities suffered from, but also a national issue. So research had showed that substance use amongst youth had become just as prevalent as alcohol abuse amongst adolescents. Researchers also began to have concern regarding the usage of substance use by the youth around the early 1960s. And during the 1970s, researchers believed that the alcohol use was just as prevalent in minority adolescent communities. And by 1980s, researchers noticed a clear decline in substance use among juveniles. However, this decline was brief and followed a sharp increase in the 1990s. Some potential causal factors. Scholars acknowledge that a probability sample of 4,023 adolescents ages 12 to 17 were interviewed about substance use, familial substance use, victimization experiences, and post-traumatic reactions to identify potential causal risk factors defined substance abuse and dependence. While considering age and ethnicity data of participants, major findings were that adolescents who had been physically assaulted, who had been sexually assaulted, who had witnessed violence, or who had family members with alcoholic or drug use problems had increased risk for current substance use or dependence. Also, post-traumatic stress disorder independently increased risk of marijuana and hard drugs and substance use and dependence. And when effects of other variables are controlled, African Americans were approximately 1/3 of risk of substance abuse dependence as Caucasians. Some cause and effects. While discussing the origin of substance abuse problems for adolescents, it is important to discuss the interrelationship between substance abuse and adolescence. This includes examining various cause and effect factors that influence each other. So scholars acknowledge a number of risk factors that may contribute to the onset of substance use, which are familial, social, and individual factors. Some factors supporting discouraging change. Factors that could help support change include advocating adequate social support, effective coping skills, outreach programs, and the implementing of the correct interventions that work for specific adolescents during recovery treatment. Factors that could discourage change include environmental influences, and not being able to have access to treatment, neglect, and mental health challenges such as depression. The National Center of Drug Abuse Statistics collects annual statistics by age, state, and other identifying factors. So the CDC goes on to explain that adolescents with substance use disorders are more likely to have physical and mental illnesses. So risk of addiction, risk of dropping out, risk of involvement in the criminal justice system, increased trends of poor physical health. So that'll be HIV or AIDS, and also increased mortality rates. Evidence of the existence of the problem or opportunity. So the National Center for Drug Abuse Statistics collects annual statistics by age, state, and other identifying factors. In 2022, nearly 49 million people in the United States reported having at least one substance use disorder. Research has also reported a dramatic rise in overdose deaths among teens between 2010 and 2021. The increase is largely attributed to illicit fentanyl contaminating the supply of counterfeit pills made to resemble prescription medications. Deaths due to drug overdose amongst adolescents doubled from 2018 to 2022. And the largest increases in these deaths were amongst Hispanic, Latin community, and Black adolescents. Research conducted by the CDC and the National shows that communities that have higher rates of substance abuse by adolescents are considered more at risk for higher rates of HIV, AIDS, and other STIs, as well as higher rates of crime and more issues concerning physical and mental wellness. In order to address adolescent substance abuse, communities need to place an emphasis on community awareness as well as harm reduction in communities that already have higher rates of adolescent substance abuse. So some best practices. So research has demonstrated the importance of interventions that take into account ways that systematic racism, economic inequalities, and cultural stigmas related to addiction and mental health affect the African American communities pertaining to substance abuse. And research highlights how important it is to include culturally appropriate approaches to counseling, community-based support systems, and traditional therapies into treatment plans to improve participation and outcomes of African Americans who are dependent. Research highlights the need for community-based partnerships and agreements with community organizations, place of worship, and civic organization in order to improve urban African American populations' access to culturally suitable addiction therapies. These partnerships can help by utilizing the community's already existing resources and support system to promote outreach, engagement, and treatment program retention. Studies indicate that interventions focused on removing structural obstacles are critical for enhancing treatment results and minimizing injustices and care access among African Americans with substance use disorders. Having these opportunities for youth to escape their communities by going to programs that are designed for them can help save children from the fate that most of them have, which is death. African American communities that blend community collaboration, culture appropriate strategies, and evidence-based methods can further attempt to meet specific needs and challenges that African Americans battle pertaining to addiction. And it is imperative to embody the goal of enhancing treatment results, reducing injustices, and encouraging long-term recovery within these communities. Some goals, interventions, opportunities. Interventions and opportunities that have been used to address these problems are substance use educational programs, substance use treatment programs, such as inpatient, outpatient, and harm reduction approach. So educational example, drug abuse resistance education, residential example, Mountain Manor Treatment Center and New Place for Recovery Treatment Center, and harm reduction programs in Baltimore City, which link people to drug treatment services such as counseling, overdose training, through mobile vehicles, and they also have 17 locations. Baltimore County harm reduction programs, and they help provide fentanyl test strips, STI testing, immunization referrals, nurse consultation, overdose education, and naloxone, peer support and referral for substance abuse and behavior treatment, and also a syringe program, but both provide needle exchange programs. So basically, if adolescents are using drugs and they're using it with needles, it's giving them clean needles. So it's important to meet the client where they are. If they are using substances and they happen to use it by needle, it's important for them to have access to clean needles. It's not promoting the use of substance abuse and drugs, but at least they have clean needles so that they don't contract any diseases that could be harmful and deadly. The interventions that will best benefit the youth in substance abuse are educational programs, risk or harm reduction services, and access to substance abuse and mental health treatment. So overall, a youth should not be encouraged to use substances, nor should they be ostracized for using substances. So the community should provide the youth who choose to use drugs with clean, safe syringes, needles, fentanyl strips, overdose education, and naloxone, and also peer support and referrals for treatment should be available to individuals who are ready to seek change. Reasons why these interventions could assist the problem. So social workers can advocate for community outreach and programs that are centered around the needs of adolescents that they are working with. These outreach programs can include educational seminars, support groups, events that focus on awareness of addiction and substance use disorders, and resources for treatment. As social workers, it is very important to reflect and discuss effective strategies for engaging adolescents. While doing so, we must consider diverse needs and backgrounds of the adolescent communities and the importance of building trust and collaboration in order to successfully partake in community engagement. Social workers can help engage adolescent communities in social work practices by fostering opportunities that lead to individual and group empowerment. And these are some references. And thank you.